According to Centers for Disease Control, Colorado children in kindergarten have among the lowest rate of measles vaccinations in the nation. Colorado ranks 42nd with 81.7% compared to most states with above 90% vaccinated. Eric, this has been a huge issue ever since we kind of, I guess, can really call it a outbreak. I don't know the technical terms with diseases that accounts for more, but from Disneyland to other states and the whole vaccination debate, this is the first time we really see Colorado in a pretty stark light. What did you make of the story?
Yeah, I was stunned. Colorado is number 42. You know what state is number 1? Mississippi. Go figure. Mississippi has over 99%, approaching 99.9% vaccination rates. This was a major dust-up in the legislative session a year ago. I believe it was the 2014 legislative session, not particularly around measles, but around childhood immunizations generally. There is a weird and almost quasi-paranoid, to my thinking, opposition that spans the poles of the two political parties. You get some of the hard right of the Republican side who thinks this is government intrusion. And then you get some of the hard, quasi-wacky left of the Democratic Party who thinks this is somehow a violation of holistic medicine and what have you. And then you have the specter of autism, which has been really put to bed, that there's just no scientific evidence that links this childhood immunizations to autism, but you still have that specter raised. And, you know, I guess when you have the hard, wacky right and the hard, wacky left together, you know, you probably have a good idea, which is that kids ought to be immunized.
That's a wacky dance partner in a ship, if you ever ask me. Natasha, you covered a lot of different health issues, 5280 and beyond. This isn't simple because it's not just about vaccinations or just one thing, but we're also starting to get into liabilities or doctors making points of, hey, if your kids aren't vaccinated, don't come here. Mm-hmm. It can't be long before a private school or a private daycare issues the same sort of thing. This getting from a vaccination debate to a public policy issue is a very short ride. Where are you at?
And it's interesting. I have a 2-year-old son who is immunized, or has gone through his series. But one of the things when we first made that decision, our doctor's team was almost relieved. I got a sense that they have this conversation a lot, that they are really fighting a battle of education. And one of the things I think is missed a little bit, because there's certainly, you know, moral or education issues, whatever else, there's also a generational issue. My generation didn't grow up knowing the impact of these diseases. So as we get further and further away, say from polio being, that's something I don't understand. It was just not an issue. So as you get further and further away from what was the original cause, why we needed to do this, the public health crisis, part of this is educating parents to say, hey, you didn't have to deal with this, but don't make your child deal with it too. So I think all of this, from the doctor's clinics to in the family room on a household level to the national level with public health centers, this conversation is not over, but it's a good one to have because it's probably been a while since we've had it.
Patty, Colorado loves to kind of buck the system on a whole lot of issues. Being 42nd in the nation seemed like we were keeping up that tradition. What do you think?
Yes, it definitely gave credence to our libertarian streak that, you know, everybody wants to make their own decisions. And then, of course, we also had a bill introduced this week for the parents' rights, which basically makes a parent could decide just about everything involving their kid, not just whether they're immunized, but, you know, no matter what movies they could see in school, everything else they'd be doing. In this case, a lot of the distrust of government is definitely part of it. The not wanting to be bossed around, but as some of us around this table, I'm sure, have had the joy of childhood measles. And Natasha has a good point. If you don't remember what it was like, you don't realize what these vaccinations can really do to help some significant problems.
Right, it's a significant disease that would have a vaccination. This is not the common cold. David, you are an expert on many issues, but certainly one of them being libertarian points of view. What do you think?
Well, one of the problems with not getting vaccinated is the risk it poses to other people. First of all, most vaccines don't confer perfect immunity, so you still might have a 1 or 2% chance of getting infected if you're exposed. And secondly, the infant population, 1 year and lower, is not vaccinated for most things because the infant's constitution isn't strong enough to take the vaccine at that point. There's so much junk science and bogus stuff out there put out by Robert Kennedy Jr. and all this stuff, but there is a germ of truth in the fact that there is some risk. In 1988, Congress said no more lawsuits against vaccine manufacturers, period, but we're going to set up a vaccine injury compensation fund for people who are injured by a vaccine. Since then, there have been 4,000 cases where the federal government has paid out to people who proved they were injured by a vaccine. The Institute of Medicine, part of the National Institutes of Health, the National Academies of Science, did a report, and they said, for the things like the measles vaccine causes autism, the weight of the evidence was strongly against that. But they also said for the vast majority of things of, X vaccine versus Y adverse reaction, of which there's about 135 being studied, we just don't know, that there's not enough evidence one way or the other to say. So I can understand, even though I disagree, why some parents would be cautious on this.